So what is BPC-157? Where does it come from? What does it do? And how do I use it? We're going to be discussing all of these things today. My name is Jason Netherland. I am a practicing chiropractor. I am a former competitive bodybuilder, bodybuilding promoter, bodybuilding judge, and I've been using peptides for the last 10 to 15 years. Certainly been longer than 10 years, but I don't know exactly how long it's been. And along this journey, I have used peptides personally. I have helped other people use peptides. I've learned a lot about peptides, and I've been along this journey for a good long while. And I just want to share some of my knowledge, my personal use, what I've seen clinically, and what I've seen in other people that I work with in terms of in the bodybuilding and fitness industry. So, what is BPC-157? Well, BPC-157 is the synthetic analog of a naturally occurring peptide that is found in the human gut. What do I mean by synthetic analog? Well, synthetic analog just means that it is the man-made version of this naturally occurring peptide. So BPC-157 actually stands for, the BPC stands for body protecting compound or body protection compound. Why is it called this? Why is it found in our gut? Well, it's found in our gut because it actually helps protect the stomach lining in our bodies from the erosive effects of our gastric juices and the acid that's in our stomach. We know that that acid has a very low pH, and in order to help digest our food, and sometimes it can cause some issues. If it can erode through that stomach lining, it can cause ulcers and things of that nature. And so our bodies have BPC-157, or the natural variant of it, in our stomachs in order to protect against that. And so what we found is, through different studies, primarily in animal models, we found that this peptide has much greater effects than just protecting the stomach lining in the human body. So what does it do? Well, BPC-157 has been found to accelerate healing, promote healing in all types of different tissue, but primarily in the ones that are heavy in collagen. Okay, and so what it does is it activates fibroblast activity. What are fibroblasts? Fibroblasts are specific cells that help induce remodeling, replication, and the growth of these different collagen tissues, which are primarily in tendon and ligament and bone. And so one of the really interesting benefits of BPC-157, because it has this fibroblast activity, is we know that these tissues, primarily ligament, but including tendon, are not great at healing. They have a low blood supply and they take a very long time to heal. They're not like muscle tissue, which has a lot of blood supply. And so we know that by increasing this collagen healing, we can recover from these injuries much faster. And in particular, once again, these ligamentous and tendinous injuries can take a really long time to heal. Now, there's also some really interesting applications in terms of that, where as a chiropractor, I see a lot of people with a condition that's referred to as tendinosis. Now, most of us know what tendinitis is. Tendinitis is typically what we refer to as an overuse or a chronic overuse injury, which means that it comes from repetitive motion, which means that basically the tendons get inflamed over time because of doing the same thing over and over and over again. And so that's an inflammatory condition. Anytime you see itis at the end of a condition, that's an inflammatory condition. And so these types of injuries have a big inflammatory component to them. But if they're not addressed and they become chronic, then they can lead to something that's called tendinosis. Tendinosis is a much more difficult injury to deal with, because what tendinosis is if you think of a tendon, and if you think of like the cell matrix that's within the tendon, which is basically, just think about like maybe a graph where there's just cells all throughout the graph, or like a sheet of graph paper where there's cells all throughout there. So what tendinosis is essentially, over time, when this tendinitis is not resolved properly, you start to get loss of some of those cells within that sheet of graph paper. You start to weaken and lose some of those cells. And so what that leads to is basically weakening of the tendon. And so BPC-157 has some really interesting applications for things like tendinosis, because you've lost some of that collagen matrix, and now we know that BPC-157 helps increase the fibroblast activity within the tissues, and it can actually help rebuild some of that lost tendon through this healing process, this collagen matrix fibroblast activity. So it's got some really cool applications and some stuff that in the health and fitness community, hugely important, but also in regular people. I deal with regular people primarily on a day-to-day basis. Basically what I'm saying are non-athletes, and tendinosis is a very common and bothersome injury that a lot of people deal with. So aside from increasing the wound healing with tendon and ligament and bone, we also know that there is actually some potential for muscle growth as well. And primarily more in the area of muscle recovery, rather than just like, oh, I'm going to take this and I'm going to build muscles, but in terms of recovery from your workouts and from your exercise sessions. And that is primarily through what we refer to as growth hormone receptor upregulation. And so what upregulation means is basically it makes these growth hormone receptors more available and more willing to accept growth hormone. So we know what growth hormone is primarily, but that's a discussion for a different video. But what it does is it essentially opens up these cells and opens up these receptors rather. It opens up these receptors so that they're more able to and more willing to accept growth hormone, which we know is a factor in growth and recovery as well. Another interesting and powerful aspect of BPC-157 is its anti-inflammatory component. So inflammation, again, I'm a chiropractor, so I deal with inflammation a lot. All of my patients essentially who are injured or have an inflammatory complex or an inflammatory component to their injury. And so we have to understand inflammation and the role that it plays, and its benefits and also its drawbacks. So inflammation is a normal part of the healing process, and it's not something that we want to get rid of completely, but it's something that we want to control. So the way that I explain inflammation to my patients is inflammation is, you can think of it the same as irritation. So the more inflamed something is, the more irritated it's going to be. And so we don't want to completely get rid of that inflammatory response, because that inflammatory response is, again, it's part of the healing process, but we want to make sure that it's not exaggerated, and it's not going to cause a lot of stiffness and a lot of discomfort and a lot of pain. And if it goes on too long, that it's going to potentially even create cell destruction. So we want to make sure that we have inflammation in check. We allow inflammation to occur, but we keep inflammation in check. And we allow the body to heal through these different processes. I don't recall if I had mentioned this earlier when I was talking about the angiogenesis. So we know that the angiogenesis is going to help it's going to help with those ligamentous injuries and also the tendon injuries. But angiogenesis, which is, I don't recall if I had mentioned, what it is it's essentially the formation of new blood cells, the new blood vessels. And so blood is essentially a transportation matrix of all kinds of different healing factors. So when we increase the blood flow to an injured area, or to anything really, what we're doing is we're allowing the body to bring more nutrients to that area, to feed that area and give it everything it needs in order to heal. So that's why angiogenesis is important, is because it allows us to transport all of those necessary nutrients and different growth factors and things in order to allow our body to heal properly, and then also remove the waste products from that area, right? So we want to get all that bad stuff out. We want to basically bring in the good stuff, flush out the bad stuff. And that's what angiogenesis is going to help do. And particularly with inflammation as well, it's going to help bring more blood flow to that area, help get out that additional inflammation and bring in new nutrients and allow it to heal. So it's got some, BPC-157 has a lot of really phenomenal benefits. If I personally had to say, what do I think is the single most impactful peptide that we know about today? I would say it's BPC-157, and I'm talking more about, peptide is kind of a a word that it's not hard to define, but it's hard to categorize what is a peptide, what is in a peptide. Technically, a peptide, all it is essentially a shorter chain of amino acids that is not as large as a protein. And so things like insulin and growth hormone and things like that would also fall into that very narrow view category of what a peptide is. But most people are not running around calling insulin and growth hormone peptides. So in terms of these types of peptides, these more experimental new peptides that we're starting to learn about and starting to use therapeutically, I would say that BPC-157, if I had to, categorize things as like a 1, 2, 3, 4, 5, most important and most impactful, I would probably call BPC-157 1A and TB500, which is something that people tend to use in conjunction with BPC-157 pretty frequently. I'd call that 1B. That's just my personal opinion. That doesn't mean it's not the end all be all or anything. But BPC-157 has a myriad of benefits and all kinds of use cases. So how do we use BPC-157? Well, there's a lot of different ways that we can use BPC-157. So once again, we know that BPC-157, the natural version of it, exists in our gut. And so what we know about that is because it already naturally exists in our gut, it's orally bioavailable, which means that we can take it orally and it's going to be very potent, right? So a lot of things that we take, different medications and different compounds, we can take it orally, but it's not going to really work. It's not going to really do anything because it's essentially going to get destroyed in the gut. It's going to be destroyed by those gastric juices and destroyed by that stomach acid. But BPC-157, because it already exists in our gut, it's already built in that natural protection for it. It's made to exist in our gut already. So we know that we can take it orally and that it's going to be orally active. And so we can take it that way. I've personally never taken it that way. I prefer to take it subcutaneously. So you can also inject it, which is what subcutaneously means. And you can inject it a couple of different ways. So when I first started using BPC-157, everybody was using it intramuscularly, meaning that you're putting it into the muscle, and we were putting it as close to the injury site as possible. So for instance, for me, I've blown out this shoulder bench pressing. To be quite honest with you, everything on me is basically bad. My shoulders are bad, my elbows are bad, my knees are bad, everything's bad, right? So one of the primary ways that I was using, or one of the major ways that I was using at one time, was because I blew out my shoulder bench pressing. And so I was injecting it directly into the shoulder in order to try to help resolve that issue. And to be honest, like I said, both shoulders are bad. So I was using it in both shoulders at different periods of time. I had an elbow issue at one time, so I was injected into my tricep, pretty much into the tricep tendon. And now what I do is I actually use it subcutaneously, which means just into the skin, right? So you just take a little pinch of skin on your abdomen or wherever you want to do, and you just inject it into there. And me personally, I have found that the subcutaneous injections actually work the best. They work better than the intramuscular injections for me. Now, once again, I've been using these peptides for a very long time. And so I don't know if this is a function over the years of these peptides becoming higher quality and better purity and just better overall, or if it's a situation where I actually respond better to subcutaneous injections. But I know that for me, subcutaneous injections are, number one, very easy, and number two, seemingly more effective. Now, I'll admit that last year I tore my calf muscle. And I did use intramuscular injections into my calf, which was not a fun thing to do. So I have large, dense calves. And so injecting into your calves is no fun at all. Nobody likes injections. I know a lot of people have an aversion to needles. Look, I'm a chiropractor. I send patients to interventional pain management frequently. And one of the first things that people tell me when I'm sending them there or when they come back from their first visit is, I don't like needles. Well, nobody likes needles. I don't like needles. I have tattoos. I take testosterone injections. I take growth hormone injections. I take BPC-157 injections. I don't like needles either. But a subcutaneous injection is almost painless and very easy to do. Like I said, you just take a little pinch of skin. You put a very tiny needle in, typically like a 31 gauge insulin needle, and you inject a very small amount of fluid. And it's very easy to do. So like I said, I like to do subcutaneous injections, but last year I was injected into my calf. And what I found was I did heal pretty quickly. Well, I got over the initial acute stage of the the calf injury pretty quickly. And what I found was when I was injecting into my calf, I was getting a lot of irritation for it. I was getting big red welts all over my calf, every place I was injecting. So I was kind of moving around my injection site pretty often. Well, every time I would inject, because I was trying to avoid continually irritating the same area. And to be honest with you, I didn't know exactly where the tear was, because guess what? I'm a guy, and so even though I'm in medicine, I did not go get my calf looked at, and I didn't get an MRI done. But now you can see a big hole in my calf where the tear is, and so I neglected myself as far as that's concerned. But I moved around that injection, and it got to the point where I just didn't want to do it anymore, because it was a significant amount of discomfort going into the muscle, all that post-injection irritation. And so I just went back to doing a subcutaneous, and it worked out fine for me. So my personal favorite way to administer BPC-157 is through subcutaneous injection. Intramuscular injection works as well. I feel like subcutaneous works better, but that's just my personal experience. Oral, I've never tried before. I've spoken to some people who've used oral, and theoretically, oral should be just as effective as injectable. But once again, I've never used it myself. And from the people that I've spoken to, it's hit or miss. Some people say it works great. Some people say they didn't notice anything. So I really can't give you much more information beyond that. There's also a nasal spray, which I don't know too many people that have used the nasal spray. So it's very difficult for me to give you any kind of feedback as far as how effective the nasal spray is. But I did speak to a guy at the gym the other day who said that he felt that it primarily helped him with some gut issues. And so those are the primary ways. Subcutaneous, again, that's what I like. That's what I think is best. But theoretically, it should work in any of these different types of administration. So how much BPC-157 should you take? Well, BPC-157 is frequently taken twice a day at 250 micrograms for a total of 500 micrograms a day. Me personally, I just do a single 500 microgram shot every day. There's a lot of different ways you can use less. There's formulas where you go based off of your body weight, how much you're going to use. But most of those formulas are probably going to put you anywhere between 150 micrograms to 250 micrograms a day. Some people will go up as high as 1,000 micrograms a day. And even in a post-surgical context, you can go even higher. You can even go maybe up to like 5,000 micrograms for an initial bolus dose. And when I say bolus dose, I just mean like one big dose all at once. But no one's going to be doing 5,000, or I've never heard of anybody doing anything like 5,000 micrograms for anything more than just a single bolus dose. I have heard of people doing like 2,500 micrograms in a bolus, and then several days later doing another 2,500 micrograms. But for simplicity, I think 500 microgram, anywhere between 250 and a 500 microgram dose a day is really good. I would probably go with a 500 microgram dose. That's what I do personally. And I think that's what a good dose is. If you are significantly injured and you're trying to recover more quickly, maybe going up to 1,000 microgram dose for the first week or so in order to try to get things under control makes sense. So that's my experience with BPC-157. That's how I recommend that people use it. And I hope that I brought y'all some insight today about what BPC-157 is. And we hope to see you around this channel a little bit more often. We hope to bring you more information about this. I do have a peptide calculator. I'm building out my blog, which I'm not the best at, so I'm working on that. And so we're going to be building out the blog, but I do have a peptide calculator on there for now, and I'll drop the link in the description below. But I hope y'all have a great day. Thanks for listening.